Okay, everyone, here is the GI medication spreadsheet. I'm going to try and go through this quite smoothly with you. Many of these medications are over-the-counter, so you're not going to see a lot of adverse effects, just a few that are that you want to watch out for. So first we have antibiotics in the classification. Metronidazole or Flagyl is a very common antibiotic for GI tract infections or prophylaxis for GI tract infections. You can take a look at this medication in your antibiotic spreadsheet. We also have proton pump inhibitors. These are known as Prilosec or omeprazole or pantoprazole or Protonix. You're going to see that a lot. Protonix and Prilosec are the two most common, and they decrease gastric acid secretion. Okay, there's a couple of things about the proton pump inhibitors that we need to know. They can promote C. diff because they can get rid of some of the natural flora that we have in our GI tract, and this is just for the proton pump inhibitors. So to counterbalance that, we might want to give them a probiotics to help that natural flora stay where it is. The other thing with these proton pump inhibitors is it can leach calcium. So someone with osteoarthritis, osteoporosis, people at risk for decreased bone mass, we might try the H2 antagonists, which we'll get to in a second. They're milder. Okay, people that are on treatment for ulcers will be taking this as well, and that they have active ulcers, and that takes about 4 to 6 weeks. Okay, in the hospital, you're going to see Protonix used a lot, but the patient does not necessarily have an ulcer. The patient is receiving this medication as prophylaxis to prevent gastric ulcers while hospitalized. That's because many of them are bed-bound, and the gastric acid basically sits in one area of their stomach and can cause a gastric ulcer. Okay. H2 antagonists are the milder form of the proton pump inhibitors. They're different. They have a different action, but they do reduce the gastric acid in your stomach. Some of these are cimetidine, famotidine, and ranitidine. Very, very common, again, over the counter. Let's take a look here. You can use these over the counter for GERD, for heartburn, and these ones can actually be used in conjunction with antibiotics for H. pylori, which is that bug that sits in your gut and causes GERD. Okay, it does have a slight CNS depression effect, and so you'll want to just kind of monitor that. They might just get a little sleepy, but it really is very mild. Okay. And of course, we're going to educate our patients that are on any of these medications to decrease the amount of acid-forming food, drink, things like smoking, and so on. Okay. We're going to skip right now over to the antacids, and these are the ones that we can just chew on every once in a while. So our Tums and our milk of magnesia. Again, this is mostly to prevent GERD. Let me see here. What you want to do with these Tums, because they're very fast-acting, and they're fast-acting, but they have a short span life, is you want to take them 1 hour before eating. That will give the most effect for this medication. Our mucosal protectants, sucralfate. So sucralfate, think about Pepto-Bismol. You know how Pepto-Bismol, it coats the inside of your stomach. Well, this goes a little bit further. It's just a little bit better than Pepto-Bismol. And it also coats the inside of your stomach and then through the duodenum slightly. It's mostly for gastric and duodenum ulcers. You take it, you can take it many times a day. You can take it up to 4 times a day, I believe. And based on a second, and take it an hour before you eat. so that it coats any gastric ulcers that you have. And then when you're eating, the food that you're eating or what you're drinking, it helps prevent irritation on the ulcer from that food or drink. Okay, so it's quite a neat little medication. And up to 4 times per day, 1 hour before meals. Okay. You can read up on prostaglandin E's, which are Cytotec is the most common one right now, and that's used for long-term therapy for patients that are taking NSAIDs to help prevent GI issues in regards to the NSAID therapy, because we know NSAIDs are very hard on our GI tract. Okay, so let's go to antiemetics. Hopefully all of you have either seen or given ondansetron or Zofran already. So this is for patients that are nauseous. Zofran, I'm going to talk about that mostly. It is an anti-nausea medication. It's very mild. It is used very frequently. It can be given IV push or PO. Okay. Some of these medications will cause drowsiness, but not much. For Zofran or ondansetron, the one big thing here is that it can prolong the QT. This is the QT interval on your telemetry strip. If your QT interval elongates too much, then you will become asystole. Now, I'm saying this, however, you will know your patient, and the physician will know the patient, and you will be able to decide if this is an issue for your patient, in which case there are many other antiemetics to draw from. Okay. We use Reglan and promethazine as an antiemetic, as well as Marinol. Marinol is a cannabinoid, so yes, it is marijuana, and many patients, even other than oncology patients, use Marinol. It can be used as an antiemetic. It can also be used as a stimulant for appetite. Okay. Laxatives. So someone that has some constipation, or patients that are on long-term opioid medications, or even short-term opioid use, should be taking some type of stimulant, softener, laxative. So there's different products here. We've got bulk forming psyllium. What that does is it promotes peristalsis. We've got Docusate, which is a softener. It draws water into the stool to help soften the stool. Ducalox and Senokot are both stimulants, and so they stimulate the colon rather than just stopping the stool. So you're going to get a quicker result, but not necessarily a more desirable result. Sometimes we want this to happen nice and smooth and gently, whereas with Ducalox and Senokot, they might have some GI cramping. And then we have osmotic laxative, which is magnesium citrate and lactulose. These draw water into the GI tract as well, but they do it much quickly. Lactulose, remember with lactulose we talked about how lactulose decreases the ammonia. Well, for a patient with liver disease, but in this particular case, we're using it as a laxative. Okay. Some of these medications as well can be used, well, we said for constipation, but also for bowel prep, for surgery. So on the flip side of that, we have antidiarrheas. So the antidiarrheas are Lomotil and Imodium. We've already talked about Lomotil in the past. They are both for antidiarrhea. So if someone has diarrhea, we can give them this to help form the stool. There's one thing that we need to know about these using Lomotil and Lomotil, and that is that if someone has diarrhea, we need to check a stool sample first to make sure that there's no GI bacteria that we need to get rid of prior to using this medication. So a great example of this would be C. diff. So if they have C. diff, then we do not want to give them Lomotil because we want all of that C. diff to come out of their system. Okay. If it comes back negative and there's no C. diff or no other bacteria that we need to treat, then we can go ahead and request these antidiarrheals if they're not already on our MAR to help the stool start forming. It's for diarrhea. The Lomotil, because there's a slight amount of atropine in here as well, they can have experience some euphoria, and then you can also get some CNS depression with this. Because the patient also has diarrhea, we want to monitor their electrolytes and their labs. Probiotics. So lactobacillus comes in lots of different, it's called lots of different things, but lactobacillus is pretty common. When your patient is on something like the proton pump inhibitors, or if they're having antibiotics, when we're talking about GI health, then it's great to have them take a lactobacillus, some type of probiotic for their GI. We want to increase their natural flora in their GI tract, and then that will decrease the effects of possibly getting C. diff. The great thing with the probiotics or the lactobacillus, they always come in these funny names, and sometimes people don't know what they are. So you can always just kind of tell your patients that they're yogurt in a pill, and then they understand what the probiotics is. So treatment and prevention of diarrhea, irritable bowel syndrome, and C. diff. And again, remember, let's add in here for patients on antibiotics. And that's a great prophylaxis for that. Okay. So Reglan is a GI stimulant, actually. Remember, we talked about it as an antiemetic, but it's also a GI stimulant. What it does is increases the gastric motility. So one of the things that it's used for is if someone has gastric stasis or paralytic ileus. Yeah. What it will do, sorry about that, what it will do is it will increase that gastric motility to try to kind of jumpstart the motility in the GI tract where they might have that ileus or the stasis. Remember, it's not such a problem here because they are NPO. They don't have anything in their stomach. They're hooked up to an NG tube to suction probably. And so with that combination of hooking up the suction to get rid of any extra juices, and then to also give them this gastric motility medication, it can help rejuvenate that motility and get rid of the paralytic ileus. Paralytic ileus are common when someone has had surgery and has had general anesthesia. It can take a couple of days for your GI tract to start working. Sometimes they won't give this medication until after a couple days, and just to see if your GI tract will come back naturally. And sometimes they'll just give it right away, just if they are forecasting that or predicting that there might be some GI issues with the surgery that they just did. Either way, there's really nothing to be concerned about. You're just looking for those bowel sounds when they come back. I just want you to take a look at these meds. These are the IBS meds, the IBS with constipation meds, the Amitza to help with constipation, and then the IBS with diarrhea meds, which is the Lotronex. Those are more outpatient medications. Crohn's and colitis, you saw the PowerPoints with the inflammation and the cobblestone and the ulcers. What we do need to do for these patients is we need to give them kind of a cocktail of medications. We need to give them steroids to decrease the inflammation, and we need to give them flagyl or metronidazole to either prevent or combat any or potential bacterial infections that might be lingering in there. We want to give them plenty of fluids if appropriate. We want to give them proton pump inhibitor so they don't have any other GI tract problems. The steroids will decrease inflammation, but remember what steroids do with diabetic patients is they increase the blood sugar, so monitor that, okay? They also decrease the immune response, which is what we want here, but they can be immunosuppressant as well. And that's it. So hopefully that was helpful. Remember to really pay attention to the bolded items. It's really important that you do know the medications and the classifications, and not so much the action, but what the indication is. Okay? Happy studying.